Hi guys, thank you for tuning in to Reid Health. Today I'd like to talk to you about a condition that a lot of us get, which is tennis elbow. Those of you that have tennis elbow or have had tennis elbow will find it was very frustrating, and it really causes detriment to anything you do. As you know, one of the most common times you get pain with tennis elbow is obviously anything that involves repetitive strain of the elbow. So this could be things like typing on a computer, using the mouse especially. Let's face it, a lot of us do that all the time, 8, 9, 10 hours a day at work, and we're constantly aggravating that area. Even things like opening jars, okay, all of those kind of activities, lifting up a saucepan or a kettle at arm's length, okay, those kind of things. A lot of people in careers like plumbing, tradespeople that use a lot of screwdrivers, repetitive strain, secretaries, accountants, people that just overuse that area may be very prone to tennis elbow. Okay, and as you would know, it's the brachioradialis muscle and the lateral epicondyle of the humerus bone which is mostly affected. Now, the interesting thing about tennis elbow in terms of how we diagnose in acupuncture, you may be familiar with the acupuncture meridians that run through this area. Now, a lot of people will come to our clinic with a diagnosis of tennis elbow, but on further questioning, we might find out that they might do a little bit of activity with their elbow, but not really enough to cause a repetitive strain. Now, of course, there's a number of people that do come into our clinic that do use a mouse, that do play sport or tennis or squash or those kind of things that do cause inflammation because of repetitive strain. And that's quite easy to treat as long as they are cutting down on their activities that cause the problem. Then it could be as simple as getting some blood to the area, lubricating that brachioradialis muscle and the tendon so it can slide over the lateral epicondyle of the elbow quite easily. It is quite a good treatment. The other kind of category of person we get, as I mentioned, is that kind of person that doesn't do anything like that. It doesn't do any repetitive injuries or repetitive strain to that area. And they have been diagnosed possibly by a medical person with tennis elbow, because those symptoms can give off that kind of pain. However, on further questioning, we might find that there's other things wrong with them at a deeper level that may be manifesting in their elbow. So going back to our channel theory, it's the channel that relates to the large intestine, which actually starts at the index finger, okay, and then runs up through the first metacarpal bone and right through the belly of the brachioradialis muscle, okay, into the lateral side of the elbow, up through the arm into the anterior eye of the deltoid, okay, and then through the trapezius and coming to an end on the opposite side of the nose. Okay, so someone with tennis elbow may also get pain radiating down into the wrist or up into the elbow, or even be responsible for some blocked sinus or hay fever. Some people may notice that when a tennis elbow gets worse, the hay fever comes on, or their immune system suffers as well. Okay. The other thing about the large intestine channel being responsible for tennis elbow is that we use the large intestine channel obviously to treat a lot of bowel problems, constipation, diarrhea, irritable bowel, even ulcerative colitis can be quite dominant. So for that kind of person who doesn't experience experiences pain, but doesn't do any repetitive strain or repetitive activity for that to be. So on further questioning, we might find that they have bowel issues. And it's interesting because when people have pain like that and we say to them, do you have any constipation or irritable bowel or diarrhea? And they might say, wow, how did you know that? By feeling the pulse, looking at the tongue, asking questions, the body will tell us what the state of the bowel is like. And it turns out that they may have had the bowel problem just as long as they have the tennis elbow. Or a very common expression of people would be to say, oh yeah, I have had irritable bowel, that's amazing that you picked that up. But I'll ask them, oh, how long have you had the tennis elbow? And I'll say, funny you thought of that because that only came up about a month after I got the irritable bowel. Well, that's very interesting in Chinese medicine because irritable bowel will cause the stagnation of energy in blood in the large intestine, which will then manifest out into that large intestine channel, okay? Making this area weak so that even the little things repetitive that the person does will then start to cause a problem. So we may not need to treat the elbow so much as treat the bowel. okay, and regulate the health and the function of the large intestine. Okay. So this is an example of how we treat holistically to cause a problem. If we were to just treat the person's elbow in that case, but the underlying cause was in the large intestine, then the person would feel better for an hour or a day at most. But by treating the underlying cause, okay, we're looking at every aspect of what's causing this tennis elbow. And the patient can then go on and do whatever they like and the symptoms will be gone, but the cause of it will be fixed as well. Okay. For any further inquiries, guys, you can have a look at our website at www.reidhealth.com.au or simply call our clinic on 9802 7000, and that's an 03 Melbourne number. Okay. Thank you for watching.